worms. And we're going to be talking about the treatments, how to treat filarial worms. And these are filarial worms that are found in different types of diseases, but they're finding them in patients that have multiple sclerosis. So if we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And this topic is super important. I'm bringing forward groundbreaking research into one of the causes of multiple sclerosis. If you follow my work, you know that I talk a lot about how all infectious disease or all chronic diseases are caused by infections. The three biggest causes of disease would be chronic infections in the body, nutritional deficiencies, and of course, toxins. But the vast majority of the toxins come from these infections. So why am I talking so much about these filarial worms? 4 big reasons. Number 1, Dr. Alan MacDonald, a very well-respected pathologist in the United States, found these small roundworms or nematodes, they're called filarial worms, in the spinal fluid and in the brain, but especially the spinal fluid. So the central nervous system of every single person or sample that he tested from people that died that had multiple sclerosis. So in every single one, he found many, many, many worms. And I've done a video on that. You can go back and look at. I shared some of the pictures that he shared where you can actually see these worms mating. You can see them in clusters. You can see the immature forms. You can see the adult forms. He said it was very easy to find them in the spinal fluid. The second reason this is so important is that for about 100 years, veterinarians have known that when these worms, these very small worms, are present in the central nervous system of domestic animals, they have symptoms identical to multiple sclerosis. They have the cramping, the spasticity, they get the drop foot, they have balance issues, they go blind, they have paralysis and numbness and extreme fatigue. So those are 2 big consistent clues. The third reason why looking at these worms is so important and studying them and treating them, obviously, but studying them is number 3, is that one of my students a couple of years ago from Europe, at the time she was a medical student, she also had multiple sclerosis, and she looked at her blood and she looked at the blood of another person that had MS, and she said it was very easy to find these filarial worms in their blood. That just to do a finger prick test and then just to look under the microscope, and she said it was quite simple to find them in their blood. So we know that they're in the blood and then they make their way into the central nervous system. That's not their ideal environment, but that's where they end up. And then we end up with neurological symptoms. So that's 3 reasons, but there's actually a 4th reason. The 4th reason is from our Wellness Champion students from the Academy. For the past at least 2 years now, after learning about Dr. Alan MacDonald's research in finding these worms, and then also myself having the incredible honor to train under Dr. Klinghardt and then Dr. Simon Yu, who's an expert at treating all kinds of parasites, we've started to adopt certain protocols to use these parasite drugs safely. And I've got lots of parasite pictures that I've shared with you in different videos. If you want to learn more about the infections involved with MS, make sure to watch some of my other videos. They would be in a playlist under Live Disease Free. That's our YouTube channel. Then go to the playlist Infections and you'll see worm pictures and you'll learn about all the different types of infections that we are aware of that need to be treated in order to recover from diseases like MS, but not just multiple sclerosis. So we have found, our wellness champions have found that we're going to talk about some of the treatments today, but we found that 2 of them really show up a lot as far as energy testing. So we don't have good tests for picking these microbes up that are readily available to us at this time. The stool tests are very poor. They usually come back false negative. But when the students are being energy tested to see which treatments will be most effective to help balance them out, they're finding that these specific drugs, and I'll talk about them in a minute, that they're commonly very, very helpful and commonly prescribed. So those are 4 really big clues. And when you have that many clues, you have to start to dig in and start to look at this more carefully and closely and start to see, like, are there better ways that we can treat these parasites, these worms? And I believe that there probably are. So we're having great success, but could we do it better and quicker? Yes, I'm sure we can. And so that's what we're going to talk about today, are the treatments. So if you've been following this series, you'll know that in the first part of the series, I talked about the link with these filarial worms in neurological diseases. So this is not just multiple sclerosis. We have students have ALS, PLS, Parkinson's, MS, and very often they really benefit from very similar parasite treatments. So the ones we're going to talk about and others. So we could have other infections also that are not similar, but we could have some that are similar. So the link between these filarial worms in neurological diseases. Then we looked at what they are. And that's really important to understand the enemy, right? To understand, where does it like to live? And are there different types? So we learned that there's different species, there's many different, so cousins. And even Dr. Alan McDonald thinks it's not just one specific type of filarial worm, but we could have multiple filarial different infections. And I teach this. I teach that when we have chronic disease, when we're really, really sick and disabled, we are in a state of dysbiosis, severe dysbiosis. We have big worms, we have little worms, sometimes flat worms, round worms. We have single-celled parasites, small protists. We also have bacterial infections that are pathogenic, disease-causing, and we also have fungus. And so we're addressing just one of them today. But we have to understand, like, because they're hard to treat, when you have them in your body for a long period of time, they've moved, from all different parts of the body, and they make their way into the central nervous system. We found out that we have to consider that they have adults and they have the immature baby or larva form. And some treatments will treat the adults and not the young ones, and some will treat the larva but not the adults. And so we have to know, understand that there's different forms based on their life cycle, where they are. So will the treatments penetrate those areas? Will they penetrate into the, be metabolized by the liver, go into our bloodstream, go into the central nervous system, cross the blood-brain barrier? So these are all really important things we have to consider when we want to find effective treatments. And we'll talk about that. So we looked at, another interesting thing when we were looking at what filarial worms are is I realized that they're nocturnal. So for testing, it's much more helpful very often to do a test after 10 o'clock at night or after midnight, I think it's probably even later, maybe midnight so you'll find them a lot more readily in the blood. So the immature form, the microfilaria, they will come out into the blood more at night. And we would really love to do a test. If you're an academic person and you want to do testing on this, I would love, or research on this, I would love to connect with you. Make sure to reach out to us. So that was what they are. And then we looked at animal studies, and that was really important because that really confirmed that when they find these microfilaria and filarial worms that end up in the central nervous system of domestic animals, and they cause cerebrospinal nematodiasis, which means that the nematodes have moved into the central nervous system, then that's where we were able to see how these animals had so many symptoms similar to those of us that are dealing with neurological diseases. There's so much evidence here. We have to start moving in this direction. We have to have more research done, and not even research, our students are just getting to work and treating and recovering, and that's the important thing. But we want to find better ways to recover quicker. So then with respect to the next section or session that we talked about, or training, was testing. That was last week. So make sure to look at those videos if you haven't yet. And the testing is really important too, because we don't have standard tests. If we were living in countries like India, certain parts of, I think Asia is pretty much dealt with already, but maybe Africa, you would be able to get testing a lot easier because it's more prevalent there, or it's understood more to be there. That's not to say it isn't here, because Dr. Alan McDonald found them in every single MS patient in their spinal fluid, every single one of them, not 80%, 90%, 50%, but 100%. They are here. They are in North America. That is why we treat our livestock, right? Our cattle are treated with these medications to prevent these worms and other worms. So they are here. It's just that this is something that has not been discovered yet in our standard of care. Today, we're going to talk about treatments. So make sure to go back and watch those other trainings if you've missed them, because there's a lot of really good nuggets. And share this information. Maybe you have a neurologist, maybe you have a doctor or a friend who's a researcher. Share this information with them. Help us get the word out. Share this in groups, in Facebook groups, in whatever groups you're part of. Make sure to share this, get discussions going, get interest, because we have to move into the area of treating infections, because that is the true answer for recovering from chronic disease, especially MS and all diseases. What I'm going to share with you is solely for educational purposes, all right? So it's very important to understand that with certain species of these filarial worms, if we have a very high population in certain parts of our body and we kill them off too quickly, we can end up having severe Herxheimer reactions, which could be fatal, which could cause seizures or be fatal. So that's why you have to work with someone, you have to know what you're doing. And Dr. Alan McDonald and others have advised that there may be a need for steroids, for corticosteroids, to suppress the immune response when treating these infections. And it has a lot to do with certain species they contain a certain bacteria. And as the worms die and they release that bacteria, then we can have a strong die-off, a strong immune response. And maybe you've heard of, even with different other infections like viruses, et cetera, where we can get these cytokine cascades, where our immune system is really going to work like over time and is too strong of a reaction, and then we have very strong symptoms. So very important that I'm not advocating for you to take any medication. I don't know anything about you. This is for you to take to practitioners. If you want to work with us, we have the Academy. That's our specialty, to help people to build plans, to find practitioners, to work forward in a safe manner. Even when they find practitioners to help, a lot of them are lacking experience because this has been sheltered from them. They've been told we don't have parasites in developed countries, and so they don't have good tests. They're not experienced at using the treatments or even recognizing parasites. So that is why our students that are taking this on themselves, as far as playing an active role in their recovery, that's how they're recovering, is that you can't leave your health solely in the hands of any one health expert. You must take responsibility for your health. And that's what I'm teaching you in these trainings. So things we have to just consider when we're talking about treating these worms. Remember, we have to consider that there are adult worms that live in a certain part of our body, and they're not always, because Dr. Alan McDonald found the adults and the immature forms in the spinal fluid, but very often, like for the lymphatic filariasis, they find that the adults would be more in the lymph tissue, in our lymph system, and then the immature forms would be more in the blood and moving into the smaller blood vessels to be picked up by mosquitoes to carry on the balance of the life cycle. But sometimes they make their way into our central nervous system, and that is a really big problem. So maybe it's that they're not intended to go there, but they end up there, and there could be lots of different reasons for that. There could be things that compromise our blood-brain barrier. There could be things that compromise our immune function, etc. Or even it could just be the level of filarial infections that we have in our body. But for whatever reason, sometimes they end up in our central nervous system. So when we're looking at treatments, we have to consider, does the treatment treat adult? Does it treat the immature form? Does it treat both of them? Because if we're just treating the immature form, the adults will keep mating and keep infecting us with the larva. That's very important to understand. And then also, what we can do is look at what treatments are used in animals and what treatments are used in the lymphatic filarial infections and there's a river blindness infection. So there are filarial worm infections in humans, and say what kind of treatments are working to help treat people that have these filarial worms. So maybe we have a different species like several of them, than maybe in the lymphatic filarial infection or the one that causes river blindness. Maybe they are, maybe they aren't, but like what kind of drugs are doing well at treating these filarial worms? And then I'm going to look at a promising triple drug therapy. So what I found really interesting is that when you look at the research for animals and for humans, the drugs that really show up are things like ivermectin and albendazole, and which I had no idea, fenbendazole. Those of you that are wellness champions that are listening, we know that fenbendazole is a parasite drug that has not been for human use, but recently now it is available for human use, and it's definitely one that's listed. And there is moxidectin. I haven't heard of that one. Moxidectin is just how it sounds, Moxidectin. I've never heard of that one, but definitely ivermectin and albendazole, I would say our students are testing really well for those two, very consistently. And then there is also DEC, which is dimethyl carbamazine. It's just how it sounds, Carbamazine. So I'll just call it DEC. DEC is quite helpful in treating these filarial infections in other countries in humans, but it's not readily available in the United States, because they say we don't have these filarial infections, so it's not readily available unless we would have a positive test. Then your doctor might be able to get special permission. That is something that I'm researching into more to see how available it is. It may be available in a pharmacy that I know of that carry a lot of these different treatments in Canada. But that's where we're at looking at it, because that's something that we haven't used yet. And we're seeing that it is much more helpful I would say it's more effective. And then levomizole, some of our students are testing well for levomizole, which will treat several different types of roundworms, but it will also be treating the microfilarial worms. So those would be some of the more common ones that are prescribed or used in animals or humans. We know that ivermectin is very commonly used with animals, absolutely. I'll talk about DEC for a minute. Apparently, it is used for both. It will definitely treat the larva form, the immature form, and it is active against the adult form. I don't know that it is 100% cure rate, because they're looking at combinations, so they have used it a lot in the past. It says here, because the lymphatic filariasis is rare in the United States, DEC is no longer approved by the Food and Drug Administration, the FDA, so physicians can obtain this medication from the CDC after confirmed positive test results. And so this is where we're having problems, because there are no standard of care test results for filarial worms in the central nervous system. But if we could show that they are in the blood, then we probably would be good enough to warrant a treatment. And just to be really careful with the DEC. So if you're going to research DEC, just please put a big star caution, because if people have certain filarial infections and the die-off is too quick, they can have serious adverse effects, all right? And that's just from the die-off of the parasite. So it's not the drug, that is it. So sometimes they will have to use maybe albendazole and ivermectin to decrease the population, not so drastically, and then they'll use DEC. Ivermectin by the World Health Organization, they've said that it is it's on the list of the most important drugs in the world. And in some countries like Canada, it is not even available. It's available to treat animals, but it's not available to treat humans. And it's not because it's dangerous, it's because they don't feel there's a market for it. They don't feel there's a need for it, which is nothing could be further from the truth. So ivermectin is really effective against some of the microfilariae, but it has no effect on the adult parasite. So this is something we have to understand. It will be really effective at treating the immature forms, but not the adult forms. And it also, in cattle, it's not really helpful for treating the adult worms in the eyes. But what's interesting is that in the animal studies I've looked at, they've actually injected ivermectin intramuscularly and found that that was more effective. And so this is what I don't know with humans, if they've ever done that with research. I'll look into it more. But I have heard actually from another practitioner too that injecting the ivermectin, this is under a physician's care, right? That who has experience, it's definitely going to be more effective in certain situations, and maybe it's if it's in the eyes, for example. But for this intramuscular injection, and this was in an animal study, the microfilariae were resolved by day 7 after treatment, and the adult ocular, so in the adult parasites in the eyes, the worms, they died in 15 to 17 days after the treatment. And removal of the dead parasites was not necessary. All the ocular signs had resolved, the symptoms had resolved within 90 days after treatment, which is really cool. So this is where over the next couple of years, we're going to learn more and more about how to treat these parasites more effectively, right? Talking about albendazole, a lot of our students are testing well for albendazole also. And again, it might not just be for the filarial worms, but our students are passing a lot of roundworms. And I know albendazole is also helpful for tapeworm, roundworms, the big roundworms. So albendazole is poorly absorbed. So that's why our students, when they're prescribed albendazole, they will have at least 40 grams of fat, healthy fat, with their meal. That helps to absorb it better. And then the combination of ivermectin with the albendazole makes the albendazole much more effective. We know that ivermectin, I don't believe that it can cross the blood-brain barrier, but albendazole can cross the blood-brain barrier. DEC can cross the blood-brain barrier. And that's important to know because sometimes these parasites, they are in our central nervous system, as Dr. Alan McDonald found. It would be really interesting to see if he could find them also in patients with PLS, ALS, etc. So a study that I was looking at, it said that when the albendazole is absorbed into this or crosses the blood-brain barrier, less than half of it, what the concentration in the plasma, less than half of the concentration of the plasma of albendazole will cross into the blood-brain barrier, across it, into the central nervous system is what I'm trying to say. So that is really important, especially in treating other parasites like the pork tapeworm, for example. And in the future, we're going to talk about Dr. Alan McDonald's more recent research that he's done, where he's found immature tapeworm larvae in the central nervous system of MS patients also. So this is where we have to understand it's not just the filarial worms, but I think that they play a part for a lot of people. The Cochrane Library, which I really love them because what they do is they look at really well done studies and they summarize. So they just bring a whole bunch of studies together and they summarize. So they looked at the effectiveness of albendazole in treating these filarial worms, and they said there is good evidence. So it's not conclusive, but looking at all the studies, the well done studies, they've concluded that there's good evidence that albendazole alone or added to DEC or ivermectin, they feel that it delivers little to no benefit for totally clearing the microfilariae, so the young ones or the adult, the larva or the adult worms, up to 12 months after treatment. So that's important to note. Evidence for the effect of albendazole in reducing the numbers of microfilariae and adult worms is inconsistent. So some studies show that it's more beneficial than others. And so this is where they're just saying that to inform policy for areas where ivermectin and DEC cannot be given, further research could help determine whether there is any effect on using albendazole alone. So again, I'm not saying there's no value in albendazole because many of our students are dealing with tapeworms and or very large roundworms. So that could be why they're testing well for it too. Then I wanted to just finish off by going over this triple therapy that was introduced about a couple of years ago. So they looked at two different groups. So this was a controlled study. They looked at giving one group albendazole, ivermectin, and DEC at just one dose, and then they observed over 3 years. And then they gave another group albendazole and DEC, so not the third, not ivermectin with it. So they gave them that as just one dose, and then they did it again with just the two, ivermectin and DEC, and they would give that one dose per year over 3 years. And their conclusion was that the 3-drug regime, so albendazole, ivermectin, and DEC given together, and again, I'm not advocating that anyone should take this. I'm just giving you research. You have to be very careful because it depends where these worms are located. We don't want strong Herx reactions. We have to work with practitioners. So the 3-drug regime induced clearance of these microfilariae from the blood for 3 years, and almost all participants who received the treatment, that was in all the participant who received the treatment. So they found that this triple drug therapy was superior to the 2-drug regime, which was administered once, or it was administered one time a year for 3 years. So they found the 3-drug regime was the most helpful. So that is something that we're going to look into more to see if that will help people recover more quickly. So that's some of the research that's ongoing on our end. Then I just wanted to finish off by sharing what our students have observed. So again, with the energy testing, we're finding that the vast majority of students that are recovering from multiple sclerosis but other students that are also recovering from PLS, etc., they are testing really well for albendazole and ivermectin. I wish we had access to DEC, that we even knew about it before, but we don't have information about that. We don't have any news to share with you on that end, but hopefully we will. So that is really awesome. And then again, another big thing is that with our students, if they test really well for, let's say, 3 parasite drugs or 5 parasite drugs, that if they just take one at a time, they're not noticing the same benefit as when they bring them together. But there has to be balance here. They're not just starting off with, if they test well for 5 parasite drugs, they're not just starting off with 5 drugs at one time, because they can end up getting a very strong die-off reaction or Herxheimer reaction. So what they're doing is the doctor is prescribing, let's say, 3 together that we know work really well, that are well tolerated together. And then maybe if they tested well for 2 others, then they would take those 2 after. So 14 days of 3 and then 14 days of 2. And then if they tolerate that really well, then in the next cycle, then they can combine all 5 together. And before they get to that point, they're following the Live Disease-Free system. So they are, first of all, they stop feeding the infections by decreasing the carbs. They're following the Live Disease-Free eating plan. They are supporting the body in various ways. So they're already feeling a lot better before they start treating. So they're detoxing properly. They're having daily bowel movements. They're sleeping well. All those things are important before you start treating. And then when our students are treating, they're using these parasite treatments that are prescribed, but they're also using herbs with it, and they are also using oxidizing agents. So like an oxygen type therapy with the parasite drugs, with the herbs, and that's where people are passing 27 inchworms. And I'm pretty sure last week or the week before I shared with you guys a 27 inchworm that was passed. And if I didn't, I will be sharing some of that next week, because we're going to do the review of 2020. And I'm also going to be sharing with you what I do to get through the holidays, have an amazing, wonderful holiday, and not sacrifice my health. All right, I'm going to go to your questions. Thank you so much for your kind words. It is Lost the Strength, LOS, the Strength Coach. Okay, I'm going to go to the top here, see if you guys have any questions. Hello, Maurice. Hi, Tiffany. Hi, Maureen. I know sometimes the research can get a little heavy, but this is so important. It is so important. If everyone really understood how significant this was, I just cannot wait until we have tests. Once we have tests, then the doctors have every right and they don't have to worry. They can just prescribe, which is awesome. And then we have a lot of experience already with how to use these treatments really safely and effectively. So we can help. There's doctors that will help to share and get that information out. Hi, Anthony. Can you continue to treat the fungus and restart killing the worms? That's a very good question. When the students are treating the parasites, they use those treatments separately from the fungal treatments. And I'm talking about drug treatments. So the fungal drug treatments are things like diflucan and Sporanox. When they're tested well and prescribed those, they have a lot of negative interactions with parasite drugs or many other drugs. Diflucan, if you look it up, which is fluconazole, it'll have like pages of negative drug interactions with other drugs. So we never mix the fungal drugs with parasite drugs. And again, a person is working with a practitioner. They make sure that they also check with their pharmacist that any drugs that they're taking, pharmaceuticals, will not interact negatively with any treatment that they're, even herbs. Herbs can have negative interactions with medications. That's why we have to move forward in a safe manner. But we would treat parasites separately from fungus. It might be different if you're using, let's say, like wormwood, which is a herb, and we would not use tincture because of the alcohol. A lot of drugs, you can't have alcohol. I know it's a little bit, but we're super cautious. The students are. So if the doctors will prescribe wormwood with their parasite medication, then they would just do capsules or the tea, but they would not do a tincture. But with the fungal drugs, which we would do for about 10 days after, that's usually what's prescribed, they would take that separately from parasite drugs. So they wouldn't do anything with that. Good question. So treat the parasites, stop, treat the fungus, take a break, then we go through cycles. Hi, Debbie. You're very, very welcome. This is my pleasure to share this with you. Hi, Alice. I'm so glad that you're learning lots. Hi, Amanda. Do you do the diet first and then the other stuff? That's the first step, Amanda. Absolutely. When you follow the Live Disease-Free Eating Plan, we've got a playlist on YouTube and on Facebook. And if you want to treat, we'd love to help you in the academy. But the eating plan is the first step, because if you continually feed these infections with a lot of food, carbohydrates, it's much more challenging to treat them. It's not worth it. The drugs, they don't cost a ton of money compared to the MS disease modifying drugs. They're very reasonably priced. But why would we waste our time and our money taking treatments if we don't get the biggest bang for our buck? We want to make life miserable for these parasites in our body, and we want to support our body and make our body stronger with lots of nutrition and weakening those infections before we start. So yes, all those other parts are very important. They're called the preparation phase, and that is very important. Hi, Tiffany. So Tiffany, you'd love to join us, but you're worried that the doctor will not be able to, your doctor won't be willing to write the prescriptions for what you need. All I can say is, Tiffany, all the students that I work with, we help them to find a way. There's not a single student that's not able to access the treatment. So that's my expertise. That's what I do. I have a network of practitioners and access. You will be able to treat. So when you're ready, make sure to reach out, watch my masterclass training first, how to recover from multiple sclerosis. And from there, then you can, if you're serious, you can book a time to chat with me and you can ask those questions and I'll get to know you. But though the time with me is just for people that when you're ready to join, but you've got questions about the academy. So watch the training, it's free, and reach out to me. I promise you that you will have access. We have students all over. We've had students in Israel, France, the Caribbean, Jamaica, like all over the place, like Australia, New Zealand, of course, the UK, Sweden, Greece, like all over the place. So you will be able to find treatments. That's my job, is to make sure that you get the help that you need. And you'll know how to take them safely, and you'll know what to take. So the US is actually pretty easy. Some other countries in Europe, it's a little more difficult, but they still get access to them. So Amanda, you recently had an MRI done, and you have active demyelation going on, and they want to start you on IV steroids. So steroids, what they do is they really suppress the immune response. So right now, the infections are active, right? They're very active, and so that's why you would have the lesions. And I forgot to mention too that we've learned through my series that these filarial worms cause lesions inside of our central nervous system. So we also know that tapeworm larvae can cause lesions. So they are pockets of infection. The lesions are pockets of infection. So this is where you have to make the decision. Do you want to continue down this path of there is no cure for MS if you follow standard of care, right? There is only continual decline of our health. Or are you going to take a different path, and are you going to treat these infections that are causing all your symptoms? Hello, Sean. You're wondering about turpentine. Is it rooster cake? Turpentine is like, it is an extract. I mean, there's different turpentines. If you get the true turpentine that is an organic extract from the pine tree, but I can tell you that it is not going to be effective enough for people that have chronic disease recovering. Like, I know all about that, and it is not going to be effective enough. I wish it was. I love different types of essential oils and different herbs, but it is not. And the coffee enemas, we're doing enemas that are the oxidizing agent. So the benefit of the enemas that we're doing is they're killing the parasites. They are also helping the liver and helping to, it's a mild oxidant for the heavy metals, and it helps to break up biofilms. So we wouldn't do coffee enemas. We know that the caffeine in coffee will actually stimulate these worms and parasites. So, and it won't kill them. So we definitely don't do the coffee enemas. Maybe if you're really in balance and you don't have any parasites or very, very minimal, if you feel that you want to do a coffee enema, then that would be fine. But we wouldn't do that in recovery. And some of our students, before they've worked with me, they have used herbs and they've done things like that, and they have passed worms, absolutely. But they're still sick. They still have the neurological diseases. We found that herbs are not enough. They will get rid of some of the smaller ones, and that's good. It's good to get the parasites out, but they're not treating the big worms, the ones that are a foot to 2 feet or over 2 feet long. They're also not treating the parasites that are in our blood, getting in our organs, and also in the central nervous system. Yeah, so PJUSINO5, watch my masterclass training, How to Recover from MS. It'll be posted just above this video and in the feed, and you'll be able to learn all the steps in that training. And then if you need support, then reach out to me and you can start right away. And that can be an amazing, next year will be an amazing year for you. How do you test to see what kind of parasites you have? Amanda's wondering. Again, we do not have good tests at this time. So instead of trying to figure out what parasites we have, we are looking at which treatments are testing the best for us, which are bringing us back in our energy back into balance. That's through energy testing. And that's how we do it. Penny, if you want to find out more information about the Academy, just watch my masterclass training. You'll get all the information you need. Melissa, hello. And Stokes. Oh, and Strokes. I'm not sure what you mean by that. Elvira, how does one decide what drug is working the best for them? Well, this is where it's a combination of things. So this is where I help the student and the practitioner together. We're working as a team. We look at your diagnosis. We look at your health history, looking at your parents' health history, looking at your symptoms. So there are very specific symptoms for parasites and also very specific symptoms for cerebral spinal nematoidiasis. There are very specific symptoms for fungal overgrowth and for Lyme disease, the Lyme infections and the separate ones. So that between all of that, that really gives us a good indication. And then we can confirm that with getting samples of the treatments and energy testing and seeing if that is consistent, which it is. And so that really helps us to build a plan. So Marianne, that's a good thing to mention with the steroids. So far, our students are not using steroids. So we haven't used DEC. Maybe DEC kills off things a lot quicker. So maybe if our student had a lot of parasites in their central nervous system, so this is something that we have to pay attention to. Or maybe it could be that we use, if they test well and they get prescriptions for maybe albendazole and ivermectin and reduce the amount of worms to less, and then introduce DEC. But we haven't had any issues or needing to use steroids. But that is something that has to be considered by the practitioner, absolutely. Melissa, you really have to work with somebody. It's something that you can't mess around with medications on your own, or I don't know. When you say test well, so this is what I teach people. And in energy testing, there's ART, there's AMA, there's Vega testing, there's EAV, there's a whole bunch of different muscle testing. Basically, when you bring a treatment or a supplement into your energy field, or it could be they could have it on this little plate, which is you're holding a metal little handle. And when you bring in something that balances you out, it makes you stronger on their little meters, or if they're testing your muscles, maybe they're pushing down on it. And our students only work with practitioners. So it's not somebody who's done a weekend course. It's somebody like a chiropractor, an acupuncturist, a naturopathic physician, and they do this all the time in their practice, and they understand a lot about physiology, and they will take the samples, like one pill of each, and they'll be able to tell. It's not an exact science, but it is helpful. It's another piece of the puzzle if it is a good practitioner. And we have to use common sense. We have to look at, again, the symptoms people are dealing with. So like if they're having a lot of those symptoms of what animals have when they have the worms in their spinal fluid, then they very likely could have those filarial worms, right? And if they're testing well for the drugs that treat them, then you're like, okay, well, there's two positives, and that just helps the practitioner to determine. Hi, Diana. Hi, Penny. Hi, Vessel of Light. I love that. So DEC is, I'm going to go back to my notes here because I know it's dimethylcarbamazine, I think it's called. Dimethylcarbamazine. Yes, I don't have it here. I'm sure that's what it is. So DEC is dimethylcarbamazine. What is your opinion on turpentine? Our students never use it. So our students have used it before they found me, but I have not found one person that has been able to recover from any kind of condition. It's not strong enough, let's put it that way. And then a lot of people are taking it with a lot of sugar, which is not helpful for candida or other microbes, because the sugar is going to go into the blood and feed the infections throughout the body. And the turpentine is not going to be strong enough to treat those infections. And when I say turpentine, it's not the turpentine you would get to thin your paint from the hardware store. This is from like companies where they have the extract from, it's like an essential oil type from pine trees. All right. Hello. Linda, hi. Your neurologist said parasite worms could offer new treatment hope for MS patients. That is, oh, yes, I know. I'm like, oh, that's exciting. But no, that's not exciting. It is so sad. It's just awful that, and I'm sure somebody's trying to get people derailed off of the truth. They're trying to tell us that by giving us, and I'm not sure which, it's a whipworm or a hookworm, one of the two. I think it's the pig whipworm or the hookworm. Maybe it's the pig hookworm. That putting that inside of us helps to modulate our immune system, and it could be helpful for MS. You can go ahead and look at the studies yourself. These people, they have these worms in them for a while, and they have such gut issues. They're like, get them out of me. No, it is true that there are certain microbes that will go after other microbes, for sure. So maybe a worm might go after a certain bad bacteria. But those big worms, they will cause their own grief and symptoms in us. And that's not the issue. Treat the infections. Don't give us any worms. Thank you very much. There's no way I would ever accept them. Could you imagine some of these worms lay 100,000 eggs in a day, and they're putting these disgusting, ugly worms in us that just cause a lot of symptom problems. And then their immature forms can make their way into different parts of our body and cause tumors sometimes. They're found, like one lady in Alberta, I shared that in one of my videos. They looked at a big tumor in her liver, and it was just a big sack of immature tapeworms. So there's a certain tapeworm that goes from coyotes to dogs, makes its way into human, possibly by accident. Maybe that's not the preferred host. And that's what her tumor was. And we find that they're making their way into the central nervous system, and we have lesions and we have cysts. So no, thank you very much. That, I think, is the biggest bunch of baloney. Never. Hi, Rob. Very interested. Make sure to watch my trainings, learn about all of this. I've got lots of stuff on YouTube, and it will completely open your eyes to what's really going on, why you or your loved one is dealing with sickness. So turpentine, I already addressed that. I love it. Like, of course, you have to be careful with any, even herb, but I wouldn't take it, and I don't take it because I know I've tried pretty much everything, and it has not been helpful for any students that have used it before working with us. There are other herbs that would be more helpful for sure. Hi, Carol. Can Lyme, Babesia, Bartonella cause lesions? I don't know if they can cause lesions. Possibly. I know that in things like Alzheimer's, that in the plaque, there's a lot of Borrelia for sure. We know that Babesia is a protist. It's a single-celled parasite that's really common in MS, and very often students have to treat that. Some of those smaller things, like the bacterial type or protist, they can be treated with herbs. But then again, a lot of these microbes are moving into our tissue, into the central nervous system. So very often liposomal or fat prepared, like where they take the herbs and they kind of put it in, emulsify it in fat so that it will cross deeper into our tissue. It'll be more effective. And then we're also using the oxidizing agents to definitely deal with Babesia. So yes, Carol, that is part of recovery. A lot of our students that have MS, or even just the Lyme students, they focus on parasites first and fungus. They decrease that tremendously in their body, feel so much better. And then if they need to treat these smaller bacterial infections, then they can do so with herbs a lot easier. But the parasites, the bigger ones and the stuff in the central nervous system, it's not enough. So Elvira, I help students all over the world. We do it all online, so make sure to watch my masterclass training. It is very exciting. It really is exciting. And then hi, I think it's Rooster Cake. Pretty cool name. You've had 2 MRIs done and you've seen an eye doctor and he says your eyes are beautiful. The MRI said that you have no scars on your brain. You have an appointment with a neurologist soon. So I'm not sure if they're saying that you have no lesions. There are people, and this is the problem with the MRIs, is that and you can watch one of my videos. I talk about the research of the MRIs to help you to understand that there's a lot of error in MRIs. There are people that have many symptoms of MS and they have no lesions or very few. There's people that have lots and lots of lesions and they may not have as many symptoms of MS. There are people that have recovered, that they're symptom-free in the early stages of working through the academy. They still might have lesions, but they have no more MS symptoms. So there is definitely, we do want to treat the infections in the central nervous system so those lesions can heal over. But some people don't even have them. And they find me and they're like, I don't care what the doctors say it is. I know that I have all these awful symptoms that are similar to MS, and I just want to nip it in the bud and get on with my life and not get a diagnosis within the next 3 to 5 years. That is very smart. And those kind of people can, if they follow the steps really well, which is very simple to do, within 3 months, 3 to 4 months, they can be symptom free. They still have to keep treating for at least 4 to 6 cycles, but they can be symptom free that quickly. So the sooner we treat these symptoms, these parasites, whatever you want to call it, the quicker we recover and the more recovery that we will have. So Rob, how do you get started? Just make sure to watch my masterclass training, How to Recover from Multiple Sclerosis, or how myself and other wellness champions have recovered from MS. When you watch that, and then if you're at the place where you're like, I want to be a wellness champion, I want to join the academy, then you can reach out to me and you can book a time with me and you can get all your questions answered. And we will send you also the Coachathon, which is a short audio, and you can hear wellness champions sharing their experience. I go much deeper into the topics of the academy. So it's the masterclass training, then the Coachathon, and in the Coachathon, I explain the cost and everything. And then at that point, if you're like, yes, I want to talk with you, Pam, I just have a couple more questions, then you can do that, or you can join and I still will talk with you. I speak with every new student. I want to get to know you. I want to understand what your health has been like, what you've been through, what you've tried. And so we just make that personal connection and you can get your questions answered, and then we're off and running, off to work. And students are usually ready to treat within 3 to 6 weeks in the program. If they follow this, it's a very part-time effort. Okay, I'm going to just finish up here. There's quite a few more questions. All right, where I lost my spot. So just watch my masterclass training first, Rob, and then you can go from there. Hi, Kimberly. Hi, Valerie. What are my thoughts on chelation therapy? So yes, part of the recovery is treating heavy metals, heavy metal detox, but we don't do that until students are feeling stronger. And we don't recommend chelation. That was kind of like an older way of doing it. So our students are doing more of a gentle from their own home. It works really well, or you can, all of that is talked about later on. So chelation, it's more expensive. It's a little bit harder on the system because you are purging a lot of minerals too, and we're already deficient in minerals, so make sure that you're supplementing minerals back. But it's better to understand that we live in this world where we're exposed to a lot of heavy metals that we did not understand. So this is something we should be doing on an ongoing basis, is heavy metal detox. So Karina, you have lesions and you were diagnosed with primary progressive MS 5 years ago, but not clear MS symptoms other than muscle tensions. Is it possible that the solutions come from parasites? Is it possible that the solutions come from parasites and I don't even have MS? MS, they don't know what causes it and there is no cure. And this is many, many years. They still don't know. MS, if you follow my work, you'll know that MS is an infectious disease. It is caused by multiple infections. So the only benefit of having the label of MS is so they know which drugs to give you, which disease modifying drugs to give you. All of those drugs are immunosuppressive drugs. And when you suppress the immune system and you are infested with parasites, it's not a good thing. It makes matters worse in time. So MS is a parasitic infestation. So could you have parasites? You do have parasites. That's why you're sick. And with the treatment, not all the MS students I work with are on the same protocols. I wish it was easier, and I wish that it was. Maybe in time we'll find a protocol, maybe a combination of 2 or 3 or 4 drugs that work. But again, if they have flukes, which are flatworms, which are really common, which cause a lot of like twitching and all kinds of symptoms, they are not going to be treated the same way as the filarial worms are. They're not going to be treated the same way as the tapeworm larvae that make their way into the central nervous system. So that is why we have to look at each person individually, and that's what I do, is I help you to work through that. So Karina, you do like whatever you have, it's infection that's causing your symptoms. So when the students are working with me, we don't really worry too much about the label MS anymore because that isn't very helpful. We're just trying to figure out which infections are giving us these neurological symptoms. Hi, Amanda. Energy testing. You have so many questions. Watch my masterclass training. And I did just speak a little bit about the energy testing. You probably heard it. So that is something we go into great detail. It's very simple, but I just help you to find a practitioner if that's what you want to do to be energy tested. And you can find people that do that in every city. We also get the same level of support. So the action plan is more of a self-directed program. The academy is where I know people and I know you. I'm working beside you. I'm answering all your questions weekly. I'm reviewing everything you're doing and your game plan, etc. The action plan is more of a self-directed. So it's still great, but people prefer the academy if they can because people want to recover as quickly as possible. And it just depends, like, do you want a call once a month? Do you want a call once a week? Do you want Pam to work with you? Do you want Pam to help you build your game plan and to be able to ask questions weekly, find practitioners, all of that stuff? That's what I do in the academy. The action plan is you still get the instruction, all the instruction, but it's more self-directed then. They're still both awesome. Hi, Mary Beth. You mentioned that the nutrition response testing is effective in treating. No, it is not. It doesn't treat MS. Somebody who's skilled at nutritional response testing, that's a type of energy testing. They would probably be able to also do the energy testing for the treatments, the parasite drugs also. You need to ask them if they can kill both the small and large worms. So the nutritional response testing is just a form of energy testing. They would use that more when they're testing which foods you are sensitive to and which ones you tolerate. But that has nothing to do with treating. How can you get access to any doctor in Ontario? That's what I help you with. We're just not up on the triple therapy. Again, I don't know. This is like when I heard about Dr. Alan McDonald's work, we didn't know that using these parasite drugs was going to be this instrumental in helping people recover quicker. The triple drug therapy, I'm just trying to find out, is it available in Canada? It might not be available. But one thing I wanted you to really pay attention to is that with that test that they did, remember the triple drug therapy, the 3-drug regime, they just did it one dose. So this is for filarial in the lymphatic system. So that's not for in the central nervous system. We might have to do it more than one treatment. That would last for 3 years. But when they took the 2 drugs, that also, they did it once a year over 3 years. That was equally as effective as just doing the 1 dose of the 3. So this is where we'll see. We're not waiting. If we can't get the DEC drug treatment yet, we're still working ahead and still recovering, but maybe we can go faster, right? And so that's what you're going to be hearing more and more about in the next, with other things. We're doing a lot of research. So, but as far as the DEC treatment, I don't know, but the other parasite treatments, that's what I help people with. And that would be Riza. So if you want help, that's what I help you with. So watch my masterclass training. Hi, Dominica. Yes, definitely other bacteria and smaller parasites are involved also. Hi, Tracy. Hi, Amanda. Okay, 2 more minutes and then I'm quitting because there's a lot of questions that keep coming in. So your mom lost sight in one of her eyes back when she was a child, and the doctor said that it could have been a worm. Absolutely, absolute. But we also know that Lyme can infect the eyes. We know fungal infections can, but now we know a lot more that worms can. Absolutely. You are so welcome. Thank you so much for all your kind words. Really appreciate it. So Carol, one more question. You've been treated I've been treating for parasites for months with different herbs, it sounds like. And you are seeing liver flukes. Is it possible to totally get rid of flukes? Yes, I'm sure it is. But again, I don't honestly think that the herbs on their own will be enough. I wish they were, but they are not going to be enough. I mean, if you don't have chronic disease and you are becoming symptom free, go as long as you can to see if you can completely become symptom free. But we have found that it is just not possible. And I've been doing this for years. I've been coaching in a very dedicated with, like, we've had over 700 people join in the academy, and at least 1,000 between the action plan and the academy, and then people before that. So we have a lot of experience using herbs first, and just to see what a difference the parasite drugs make. And the parasite drugs are tolerated so well when you take them properly. So it's not scary. It's kind of like deworming your dogs, but you have to take them properly. So I already addressed that, Dominique. I said all the different drugs for these filarial worms, but that would not be for flukes and tapeworms, etc. We're just talking about the filarial worms today. Amanda, you were also on Copaxone. For 16 years, you tolerated it really well. So the Copaxone, I'd like you to do a little research. Remember I told you about the Cochrane Library? They're really good. So they have, if you do Cochrane Library and Copaxone, you'll look back and you'll see that over 20 years, or about 20 years, that they've looked back at all the well-done studies on how effective Copaxone is. And they have found that in all the well-done studies, when they've reviewed them, none of them, there has been no indication that Copaxone has made any kind of an improvement or benefit for people. So you can check that out yourself. And so maybe it had more to do with your environment. Maybe it had more to do with how well you were taking care of yourself. So there's a lot of different things that will make these infections more active. If we eat healthier, we're not going to go downhill as quickly. If we get enough sleep, if we manage our stress. But all those other things can make our environment such that the infection is more compromised, the immune system is more taxed, and then the infections will be stronger. All right, I think I'm going to go because there's a lot more. I'm just going to do Fawn here because, Fawn, I know you and you're awesome. She is a wellness champion. So she realized that on her 4th treatment cycle, you needed to do a flush of your lymphatic system, and that's awesome. Yes, absolutely. So this is where we need to definitely use a holistic approach. Just like we have to be ready to treat, and I'll end with that. We can't just pop a pill and expect to get better. We're dealing with a lot of constipation and possibly diarrhea. So we need to be definitely supporting our body in various ways so that our body can handle the killing of these parasites. So that's very important. Next week, so before I finish, just make sure to help me get the word out. Share this video if you enjoy the trainings I'm doing. And if you head over to YouTube, make sure to subscribe, hit the notification bell. I am going to be streaming a lot more often in the new year. I've got so much to share with everyone, and I really want to speed up this change of the way that we treat not just MS, but other chronic diseases. Make sure to join me next Wednesday, same time, same place, and I'm going to wrap up the year 2020, do a review of what we've learned, the successes our students have had. You might see a couple of worm pictures that'll be shocking. I will warn you if you don't want to see them. You can turn your face away. And I'm going to share with you the biggest tips that I have for how I make it through the holidays, because it's really busy even getting up to the holidays, even though we're dealing with lockdowns. It's a busy time of year. We're trying to get things ready and we're trying to get gifts, etc. So how do we make it through the holidays and we still keep our health and we thrive instead of just barely hanging in there, right? Some tips that we can use through the holiday season so that we can hit the ground running in January and make it the very best year we've had in a very long time. We need our health in these crazy times, don't we? All right, so I will see you next week, 5 o'clock Pacific on same place. Take care and bye-bye for now.